Perforated eardrum sounds pretty serious, doesn't it? Fortunately, most perforated eardrums are just a small hole and your body will heal itself, so it tends to be temporary. Now, the eardrum transmits sound waves. It turns them inside your ear into messages which get sent to your brain, and your brain interprets those as what you're hearing me do now, which is speaking, and so on. The causes of perforated eardrums, most commonly, probably ear infection, a middle ear infection leading to pressure building up behind the eardrum, and that perforates the drum and the pus comes out. The good news is that the pain of a perforated eardrum, or the pain of earache caused by an ear infection, will often be relieved by that perforation happening. Loud noise can also lead to a perforated eardrum, although it does have to be pretty loud. So can direct trauma, and we may be talking there of poking anything, including cotton buds, into your ear. If you haven't heard a doctor say, never put anything inside your ear that is smaller than your elbow, you're hearing it now. Barotrauma also, when you're diving, for instance, can sometimes lead to perforated eardrum. That's a very dramatic pressure change. Now, while your drum is perforated, you are going to be more prone to ear infections because the eardrum does act as a barrier. So you just need to take precautions to try and avoid, for instance, getting your ears too wet, not diving, and so on. You often don't need any other treatment, but if it does get infected, then you will probably need antibiotics, either in topical form or by mouth, or sometimes a combination. If the symptoms don't settle, you may need surgery, but that is uncommon.